Thanks, Peggy. Good morning, folks. Are we up? We're up. Charlie sticks to his homework. I don't. Charlie has done what will be the definitive work as soon as it comes out, and we all need to know when it's going to come out and where and so forth, on reviewing the literature and compiling some nice meta-analytic figures associating alcohol use with firearm violence specifically. I'm not going to, it's a great paper, read it. I'm not going to critique it. What I'm going to do is re-emphasize some of his findings because they deserve it, but extend them a little bit, talk a little bit about the background, some areas that were beyond the parameters of the homework. I'm always one of those people who never understood the assignment. One of the important points that's between the lines here, as somebody who's been working on firearms for a long time, but came to the sort of same realization that I think Charlie has some years ago, is even if our target is firearm violence, there are many ways to approach that target besides through firearms themselves, through risk factor modification, whether it's at the individual or social policy level, and you'll see echoes of that theme in what I have to say today. Let's talk first just about how common these exposures are to alcohol and to firearms. So first point here is, boy, do we drink a lot in the United States. At the top here are data from the 2010 BRFSS, 30-day prior alcohol use. More than half the population endorses some. 17% will tell a government surveyor that they have binge drunk in the last month. That's 5 or more in a sitting for men, 4 or more in a sitting for men. 6% say they drink on a chronic basis. That's 60 or more per month for men, 30 or more per month for women. I'm sorry about the comma. I love the taste of a little humble pie in the morning. Second exposure here obviously is firearm ownership. Best estimate is that there are somewhere on the order of 50 million to 60 million individual firearm owners in the United States, about 300 million guns, give or take, less than 5% of the world's population, more than 40% of firearms that are in civilian hands. Excuse me. If anything, these prevalences may be going down a little bit at the individual level. Now, just back of the envelope mathematics, if you put those two exposures together, we arrive at bullet point number 3. Let's look at the low end for a second. At the low end of the range, there are maybe 9 million people who personally own firearms who binge drink in the United States in a given month, 2.5 million who drink moderately to heavily, depending on your definition, on a chronic basis. But notice the range. It's fairly substantial, and let me show you why. More back of the envelope math. Extending these findings, which are work that we did using BRFSS data from the mid-1990s, which was the last time, and this is a hint for the future research slide yet to come, the last time the BRFSS asked people in the same survey, do you own firearms and what do you do with them and what do you do with alcohol? Those data are now 20 years old, time for a relook. Excuse me. The odds ratios you're seeing here, I got rid of the confidence intervals just to clean up the slide a little bit. This is published, the findings are significant. These findings are, there are about 15,000 respondents in the survey. Findings are adjusted for age, sex, race, and state of residence. Let's just take the top row. Firearm owners, as compared to our referent group listed at the bottom there, people who don't own firearms are more likely to drink heavily, to binge drink, more likely to drink and drive, more likely to drink heavily on a chronic basis. But the sort of icing on the cake in this study was that people were asked not just about alcohol use and firearm ownership, they were asked about alcohol behavior and firearm behavior. And that's where we dive into the meat of the slide, where we were able to see, and you can see the sort of, if you will, dose-response relationship here. Among firearm owners, those who took risk behaviors with firearms were also more likely than others to take risk behaviors, to engage in risk behaviors with alcohol. No big surprise, risk behaviors co-occur. We know that, but this is the only place we know it for these two behaviors. So I'm just going to pick one example, dead center, the middle of the slide. We're looking at the odds ratios for the drinking behavior, drinking and driving, and the firearm behavior, driving and riding with a firearm. Firearm owners who drink and drive are 3 times as likely as people who don't own firearms to also drive or ride in a car with a firearm. So now you've got drunk people in a car with guns. Firearm owners who don't drive and ride with firearms in the car are only 60% more likely than people who don't own firearms to drink and drive, which by comparison I think is probably reassuring. Got it? All right. This is the heart of Charlie's presentation. And I said it before, and I've had the leisure, at least the leisure of a plane ride to look at the paper and think about it. I really think that what he is presenting is going to be the definitive work on this. So cite it lots. He emphasized, and I'm going to re-emphasize, first off, the very high prevalence of acute alcohol intoxication among people who are involved in violence. 37% of violent felony perpetrators, and these are people who are in prison, who are being asked by BJS surveyors, say that they were intoxicated, not alcohol use, drunk. Average intake 9 ounces in the hours immediately preceding the crime. 37% of them were drunk at the time that they committed whatever violent felonies got them in the slammer to be interviewed. You've already seen the very nice weighted means that Charlie has calculated for prevalence of acute intoxication. There they are again. I'll just mention, as you look at those numbers for intoxication, heavy use in his paper, remember that he has used a conservative definition of heavy use. The BA has to be above 100. Most state per se laws use a lower threshold. That's because he's using what the literature is using, and he's stuck with what's reported. But as Charlie points out, and I completely agree, prevalence is not risk. This just says that alcohol use is common. Well, maybe 1/4 to 1/3 of the general population is intoxicated at any time. Any drunk people in the room at the moment? Risk is what matters. And by this time, you've looked at the rest of the slide. 3 to 6-fold increase in risk for pre-existing alcohol abuse and interpersonal violence perpetration, not intoxicated or use at the time necessarily. 3 to 6% for victimization acutely, and obscene odds ratios for acute use and suicide. And there is a dose-response relationship. The more intoxicated you are, the more likely these things are to happen. And since Charlie and I and Jim Mercy earlier dwelt on suicide, let's digress for a minute and let's look at firearm suicide in the United States and firearm homicide. One of the myths of firearm violence in the United States, at least fatal firearm violence, is that it's decreasing. And that is simply not true. It is less than it was in the 90s, but overall, the rate of fatal firearm violence in the United States has been as flat as a tabletop for more than a decade. Homicide has been trending downward, although not so much in 2012, the most recent year. We'll see what's going on with that. But there has been a steady rise in firearm suicide, such that in 2012, nearly 2/3, 64%, of all firearm fatalities from firearm violence in the United States, were suicides, not homicides. And let me point out also from this slide that suicide has been more common than homicide, firearm suicide and homicide in the US, even during those times when rates of firearm homicide were at their peaks, as they were in the 80s and early 90s. When I was a punk 30 years ago, I did this same kind of analysis looking back over much of the 20th century, and what I just said was also true for much of the 20th century. And who's at risk? This is suicide, not homicide. This is not the graph that everybody's used to, where risk is high early and goes down. Risk for the group at highest risk here, white males, rises early and just keeps on going up. For the sake of time, I haven't put in a couple of slides that are in the paper, but I'll summarize it this way. 48% of all deaths from firearm violence in the United States in 2012, nearly half of all the deaths, were suicides among white males. We tend to think, and those not in this room tend more than we do, I think, to conceptualize firearm violence as a problem of young men of color, which among other things makes it easy to do nothing about it. Let's face the facts. And I look forward to the time in the very near future as this data circulate, when old white guys, policymakers, will realize these people look like me after all. A little bit on intervention. As Charlie has mentioned, federal statute is silent. Alcohol is excluded, not omitted, specifically excluded from the list of controlled substances for which there is a basically non-functional ban on firearm possession under federal statute. What federal statute does say is it's a federal crime to buy a gun in a state where it's against the law to buy that gun at that state and at that time. So you could prosecute somebody federally for violation of a state law that says you can't buy a gun if you're drunk, or you can't buy a gun if you're an habitual drunkard. But habitual drunkard, as Charlie has mentioned, is a non-enforceable standard. Who's going to define that? It's sort of like adjudicated as a mental defective, which is our mental illness criterion. It's sort of like illicit user of or addicted to controlled substance, which is our controlled substance definition in federal law. They are simply not enforceable. And as Peggy just brought up, there are states that have expanded the intersection between firearms and alcohol. There's an increasing number of states where you can bring guns into bars legally, as long as you carry them concealed and as long as you don't drink, where it's legal to carry a concealed firearm in public. So think about it from the bartender's point of view. There's a person sitting in front of them. They might or might not be armed. If they are, the firearm is concealed, like the one I don't have sitting right here, but you can't tell, except that I tell you. Is the bartender going to say, so you packing, before they serve them? Of course they're not. This is wink and nod policy making. The other thing that's happened is an increasing number of states now allow anyone who is not prohibited by law from possessing a firearm to carry that firearm in public. You don't need a permit. You can just do it. And there's one state, Arizona, where you don't need a permit to carry a firearm, and you can bring that firearm into a bar as long as you're not drinking. Do not go to a bar in Arizona and make somebody upset. Now, I have to spill a secret. I've been interested in alcohol and firearms for a while, have been writing a paper on the intersection between alcohol and firearms and policy and looking at risk and so on, and had been thinking, God, I'm going to have to do a systematic review. I don't want to. And then somebody called and said Charlie was doing it, so it's perfect. And I want Charlie to know the paper I'm writing and yours are going to complement perfectly and not compete, and it's all good. But we did a little bit of working. There are 3 states, as he's mentioned, that have enforceable standards, a multiple DUI standard. I asked them, they don't enforce it. So we're sort of back to square one, but we'll be talking about that. Charlie mentioned the proposal to extend prohibition criteria to people who have multiple DUI convictions. I'm part of a consortium. There are a number of members of this consortium in the room called the Consortium for Risk-Based Firearm Policy. It's sort of a virtual think tank that has produced some white papers and stuff. And one of its recommendations is to do precisely that. Last year, I took that proposal to the California legislature that for a 5-year period, we prohibit firearm purchase or possession, and we're actually now doing something about possession in California, to people who had multiple convictions for DUIs or similar offenses in a limited time period. And in their first consideration of that new idea, the legislature passed it. The governor, Governor Jerry Brown, vetoed it. Why did he veto it? Because there was insufficient research evidence on the intersection between alcohol use and risk for violence among firearm owners. So we're in the evidence business. This ain't over. Other question, however, is would such a policy work? It's not been tried before. We don't know, but we have some useful parallels. Here's one. And Jeff Swanson, who's talking this afternoon, may be talking about the mental health stuff from Connecticut and elsewhere. Perfect. So this is one related to criminal history. California undertook a policy experiment. We prohibited firearm purchases by people who had been convicted of violent misdemeanors. Remember that in most of the country, it is a myth that people with histories of violent criminal activity, convictions for violent criminal activity, cannot buy guns. They can, as long as those convictions are not for felonies. In California, we changed the law. And our group did a study comparing two groups of people with violent misdemeanor convictions who sought to purchase handguns. One group, new law, purchases denied. Other group, old law, purchases allowed. And these are the results. In the group that were able to purchase their firearms, risk for a crime involving firearms or violence was increased after adjustment for the usual suspects over a 3-year period of follow-up. There was no difference in risk of arrest for crimes not involving firearms or violence, a specificity of effect that allows us to infer that perhaps what we observed was due to the law. And the red light is on, so I'm going to very briefly put this up. You've heard it. I'm going to reemphasize, we need more evidence, more information on the coexistence of risk behaviors, about risk among specified populations, outlet density. I think I keep waiting for the larger scale version of Charlie's and of less than 20 pilot study. When are we going to see that one? And we need research on effects of interventions. Thank you very much.